Hi, everyone. Good afternoon to everyone. My name is Chu Yem Kuen. I am your presenter and your moderator for today's seminar. A little bit about Osteoporosis Awareness Society of Kuala Lumpur and Selangor. Um, it was formed about 11 years ago with the main object to create awareness about osteoporosis to the public in general, about the cause and effect of osteoporosis and how it can affect a person's life. Um, Based on statistics in Malaysia, 1 in every 3 women and 1 in every 5 men will have or will have experience of a fracture in their lifetime. Women tends to be 3 times more prone than men. Um, Over these past 11 years, the society has been reaching out to a lot of places, especially to the rural areas, where we reach out to the people who have no knowledge or awareness about the disease. The society has gone to as far as Sabah and Sarawak to create awareness by way of campaigns and so forth, and educating people generally. So because of the pandemic, since last year, we have not been able to do any awareness campaigns. So we have decided to follow the norm to have webinars and to, at the same time, create awareness to the public in general. Um, there will be a series of webinars for this year lined up, and just watch out for it. Okay, for this first of the series, may I introduce you to our speakers, Dr. J.K. Lee. Dr. J.K. Lee is a consultant orthopedic surgeon, and he is one of the founding members of the society. Welcome, Dato. And we also have Professor Dr. Tan. Um, she is a geriatrician, um, also another one who has a lot of experience and knowledge about osteoporosis and the cause and effect of osteoporosis. Third, we have Mr. Jason Chan. Mr. Chan is a physiotherapist, and again, he's one of those crucial people helping people to get better and to have better and healthier bones, to create stronger bones. Okay, without much ado, Dato, what is osteoporosis?
Thanks, Vishu. Thanks for the kind introduction. And I hope all of you can hear me loud and clear.
Yes, we can, Dato.
Okay, for the next 20 minutes, I'm going to bring you for a tour, okay, about this condition, which is often get neglected. And as you know, that many of us are more aware and worried about the hypertension, diabetes, and even like heart problem and so on. But osteoporosis, to many of us, actually something appear like quite new. What is that? All right, what's that to talk about? And you get old, you get osteoporosis, so no big deal, right? So let's bring you for a tour today, this afternoon, all right, on this 20 minutes tour on the condition called osteoporosis. Now, the main concept that we have to talk about osteoporosis is actually we want to promote healthy bone for life, this theme and this awareness among all people, right? And I think it's not uncommon to see these pictures, to see our grandmom or moms having this hunchback, walking slow, and also at the same time history of fracture before. So this is actually a common picture that in our daily practice in clinic as well as in among public. What is actually underlying these conditions here? You can see that this granny that had a hunchback and she's walking with a stick. And she might have a fractured hip before, or she might even have a fractured wrist before. And the underlying problem that causing this kind of picture, this kind of severe hunchback, is actually osteoporosis. Now, osteo actually means bone. Porosis means porous. means a disease or a condition where there's a porous bone. And as mentioned earlier, many of us are more aware and worried about hypertension, diabetes, and all the other conditions, but forget about bone health. In fact, there are many people are suffering from osteoporosis and fractures. And in fact, the incidence of osteoporosis is actually more than a combining incidence of breast cancer and cervical cancers in the female population. And in fact, 1 in 3 women have osteoporotic fractures in their lifetime, and 1 in 5 men might sustain osteoporotic-related fractures. And what about all this osteoporosis? We are talking about those post-menopausal related, but not to forget, there are many other risk factors can also cause osteoporosis, which include like diabetes, early menopause, and steroid treatment, and so on. These are all these underlying causes why we develop porous bone. Ultimately, osteoporosis leads to fractures. And you're not going to have a fracture when you're 70, 80 years old. It's something bad to have, particularly when the hip fractures. And when you talk about bone health, women's health, we said, well, this is a problem of Western population, right? And I think to do with Asian, isn't it? And you see in Kuala Lumpur, in Malaysia, in Asia, we had sunlight every day. And our people are very hardworking. And it's a problem most of the Western populations. It's not true, in fact. And more than half of the hip fracture incidents by 2050 is going to happen in Asia. So Asian skeletal health issue is actually something that we deserve our attention and also deserve our care from all the medical practitioners and so on. So Asians going to face osteoporosis and related fractures, and this is a big issue, a hidden issue. To understand bone health, to understand osteoporosis, we have to start from this concept called peak bone mass. When we are born, until about 20 over years old, we accumulate our bone. We form bone, we lose bone, right? So during this 20 over years, we build bone more than you're losing bone. When you reach about 25 years old, you reach something called peak bone mass, which means that that's the maximum bone mass that you have at the time, and which lasts for 20 years, 20 over years. When you reach about 40, 45 years old, then you notice that, well, because of menopause, and the bone loss is actually speed up during those first 5 years, particularly. And then after that, the bone loss slow down again. So this kind of peak bone mass concept is very important because when you talk about prevention of osteoporosis and take care of bone, build bone, we want to hit high peak bone mass. Just like, you save a lot of money in your bank, okay? And as much as you can. So when you actually, at a certain age, when you actually want to spend money, then you still have some money left in the bank for yourself. And also this peak bone mass concept, men normally have higher peak bone mass. Okay, that's why the incidence of osteoporosis is also lower in men compared with women. So peak bone mass is a very important concept that we need to know to understand bone health. And also we need to understand what actually determines the bone strength. Bone strength is determined by combination of bone quality and bone density. So it's not just bone density alone though. The bone density scan that you do, the DEXA scan, they actually measure the bone density. And that's not the only determining factor affecting the bone strength, because underlying that, the structures, architecture, the bone quality also play a similar, equally important role, if not more important. And that there are many points that which determine the bone quality as listed in this picture here. We build bone before we lose bone. And in a young lady, in a young man, this is a bit imbalance, okay? But when you reach menopause, either natural or surgical menopause, you find that you're actually losing bone faster than you're building bone. So you achieve something called a negative balance when you reach about 40 over 50 years and above. So you lose bone more than forming bone, see? And there's cells to break bone, there's cells to build bone in our body. And all this so-called bone turnover, it actually happens in in terms of millions units in our body, in our bone. And of course, we need to understand what are the risk factors for someone to get osteoporosis and fractures. And we divide them into non-modifiable and modifiable. When you reach about 60s, you might look 40s, okay? Sometimes you come to the CS, oh, you do not 40 at all, no? You just look, when you do not 60, you look 40, no? Yeah, it's true. You look 40, but by age-wise, you're still 60 or 60 plus, right? So advancing age, you compare an 80 years old and a 40 years old lady, of course, a high incidence of or chances to get osteoporosis in the 80s, isn't it? And ethnic group also play a very important role here. And it's also a disease of, we call ladies first, all right? And particularly for those ladies that actually have premature menopause, either surgical menopause or natural menopause. And family history of osteoporosis or fractures of hip, particularly, all right? Like mom had hip fractures because of osteoporosis, the chance the daughter has this is actually higher. And of course, you had a fracture before, which is related to osteoporosis, the chances you have a second, third, and subsequent fractures is also very high. So some of these are actually non-modifiable. But the modifiable are those low calcium vitamin intake, sedentary lifestyle, you know, you don't like sunlight, you don't like to go out, you just want to stay at home, sit on the sofa, watching the TV all the time, and smoking, excessive alcohol, particularly in men, and BMI of less than 19 also a very important factor there. And of course, if you have impaired vision like cataract, you have a lot of instability, you know, recurrent fall. Of course, the higher chance you get more fractures, right? Now, what actually happened? We need to know the architecture of the bone. This is how it looks like, the bones, okay? And the outer layer called cortical bone. You compare an 87 years old individual and a 20 years old individual. Look at the porosity in the cortical bone. Does it look familiar in some of you, let's say in a house, you have the termites, you know, and damaging all your furnitures and all those stuff? So it actually looked like a termite affected sort of piece of or whatever wood that you have, a wooden furniture that you have at home, right? So there's actually there are many holes inside, and that increases the porosity of the cortical or the outer layer of the bone. Whereas what happened inside the bone itself, in the marrow, we have all these things called trabeculae. Trabeculae, very important in terms of providing the bone strength. Trabeculae are all these line, vertical, horizontal line, and all these line we call the connectivity. So in osteoporosis, what happened in the marrow is that all this connectivity is broken off, thin, and then that affect the actual microarchitecture of the bone and the strength of the bone. But something happened at the cortical layer, which is the outer one. All right, remember the termite bitten things, all right? And then second is the cancellous bone where you get loss of connectivity and also thin out all these lines inside the bone. Now this is actually our backbone of vertebra. You can see the changes there inside the bone itself. And of course, this cartoon tell you cortical bone at the outer and the trabecular bone at the inner. So all these things become broken off and you had holes in the bone, and of course the bone become porous. That's why your bone break easily. So that's why osteoporosis means a porous bone disease. And but sad to say that we normally call osteoporosis as a silent epidemic. You don't get fever, you don't get cough, you get chills, wriggles because of osteoporosis. But gradually you notice that mom, like, you know, she's losing height and she look shorter. And she get this hunchback. And this cartoon actually show very well, actually 3 generations. This photo is taken by a Korean surgeon, orthopedic surgeon, where it showed 3 generations, the grandmom, mom, and the daughter. You can see mom or grandmom had loss of height, had this kind of hunchback, you could dowager's harm, and some of them even tell you the history of fracture before. And but sad to say, many osteoporosis are only diagnosed after they have the first fractures. So loss of height, back pain, particularly the upper back at the middle here between the thoracic and the lumbar spine, and with this hump at the back. So these are all signs to tell you that grandmom already has osteoporosis and she already has multiple fractures involving. Why our backbone collapsing down? Because a bone is so porous, so thin, that the bone by itself, it collapses, crumble. You don't need fall. A sudden sneeze or cough, a bending forward to lift a weight or to carry a grandson, a granddaughter, that you can get a severe, sudden, severe pain in the back. Because why? The bone just crumble down. And so these are all the signs suggesting, hey, you already have osteoporosis, and this disease has been there for years. International Osteoporosis Foundation actually designed this calculator, and actually this FRAX calculator is actually based on the risk factor that we have. You can actually calculate what is the fracture risk over the next 10 years. So that helps us, that become a very important tool in a clinical practice to identify those who need to be treated, those who have an underlying osteoporosis, because it predicts the fracture risk over the next 10 years. And of course, in clinical practice, most of us send a patient for a bone density scan, the proper DEXA scan, the DXA. It is a very low dose X-ray scan that you lie on the table and the X-ray scan on your backbone, which is the lower the lumbar spine, and also the hip bone. And this is actually the gold standard in terms of the diagnosis. And of course, we also use it to monitor treatment. And we also actually include the FRAX calculation into the DEXA scan to predict your fracture risk of the next 10 years. And one very common thing that we see in a clinic in some of the outside screening is that you do the ultrasound of the heel bone. Ultrasound of the heel bone is actually used to raise awareness among the public about osteoporosis, but we do not use ultrasound of the heel bone to confirm the diagnosis. And more important, it cannot be used to monitor treatment. So if you have an ultrasound done at the heel bone and it shows that your bone density is low, you do have osteoporosis, please go ahead to proceed with the next investigation we call a DEXA scan or DXA. As I say, this is a very low dose X-ray. It doesn't cost too much actually, in the range of 100 plus to 200. So you do not do all this DEXA like every month, every 3 months. You might just need the DEXA scan when you're on treatment every 2 to 3 years once. So it's not too bad in terms of the cost, okay? Now, with all this thing, losing bone, losing our cortical bone, cancellous bone, what happened? So Michu asked the question, what is your osteoporosis? So up to this stage, I believe all our friends, all right, and you do have an idea. Osteoporosis means porous bone. The bone changes in the cortical and the cancellous layer. So the bone can even so brittle that it breaks, it crumbles down. But ultimately, we have been talking about bone brittle and crumble down and fracture, right? That's why ultimately, when you talk about osteoporosis, you want to prevent fragility fractures. Fragility fractures, by definition, means you had a fractures from the fall at a standing height. A young man like me, right, a young lady like me too, right, we don't break our bone easily when we fall down, right, because our bone is strong, okay, and our bone densities are good. But in grannies, 80 years old, to sleep, and very common story is that at night she go to the toilet, she go to the bathroom, the floor is slippery, and then she actually fell and she landed the buttock. And all these stories are so common that grannies actually fall down in the bathroom at night, middle of the night, and she sustained hip fractures. Hip bone supposed to be very strong and very, high strength. And it's not easy to break a hip bone, but if you have osteoporosis, you fall from standing height. You actually land at the buttock and you fracture hip. So this kind of fractures is called fragility fractures. A fracture of vertebra when you have a sneeze, achoo, wow, severe back pain. And you bend down, lifting a small weight, you get a fracture of the spine. These are all fragility fractures. So that's why ultimately we want to prevent, we want to treat diagnose early osteoporosis is to prevent fragility fractures. And the common site that we have see in clinical practice are your wrist, common among those 50s, and 60, 70, a lot of them fracture the spine, the vertebra, and hip fractures happen a lot in those 70, 80, 90 years old. And tell you, you don't like to have a hip fracture when you hit 70, 80, because that carries the highest morbidity and mortality following a hip fractures. And this MRI picture show a patient who already had a fracture like this one. You can see the vertebra bilaterally square like that, right? But you can see these two segments there collapse down. This almost completely collapsed down. And this is also another fracture there. So this patient had a fracture, 3 segments here before. And this round, when she come, she had a new fractures over here. And because of the deformity of the spine, you do get kind of loading, all right, forward, bending force, and you actually predispose you to a further fractures of the vertebra that worsen the hunchback. And of course, talk about osteoporosis, talk about fractures, and in terms of treatment, can we treat osteoporosis? Is there anything can be done? Is there actually no treatment, no cure? To talk about treatment of osteoporosis, of course, for those smoke a lot, drink a lot, that's the first thing you have to cut out, okay? And you have to modify activities, all these bad habits, and this is gone. And not to forget, you must have adequate calcium vitamin D intake though. And many of us don't even know how much calcium intake that we're supposed to have, what we call calcium requirement, about 800 milligrams to 1,200 milligrams a day. And not to forget vitamin D. Vitamin D deficiency or inadequacy is a big, big problem that we see in our clinic every day. And the vitamin D deficiency, what? In Malaysia, vitamin D deficiency, as I say, the sunlight is there every day. You talk about in those European countries, America, and so on, that's possible. In Malaysia, the vitamin D deficiency, it is. In our practice, many elderlies, they do come to see us, they lost bone for years, they develop osteoporosis. We do a blood test for them. In fact, the vitamin D level is actually very, very low. A sunlight of 15 minutes a day, is it adequate? In many instances, it's not adequate. In fact, vitamin D deficiency is a hidden clinical problem. And I always say, when you lose bone, you lose muscle, because sarcopenia. So vitamin D also play a very important role in treating sarcopenia. So you lose bone, you lose muscle. And when you treat, you must have adequate vitamin D and calcium every day, whatever medicine you use. And calcium intake, most of us emphasize on the natural products. And if your calcium intake from natural products, natural food, does not meet your requirement, that's the time you need calcium supplement. But for those who are actually elderly, already osteoporosis, and most of them, they actually do need calcium vitamin D supplement as well. So do not forget, not only calcium is important, vitamin D is equally important. There are many medicines available to treat osteoporosis. You treat osteoporosis by drinking milk alone? No way. To treat osteoporosis by taking calcium vitamin D alone? No way. They are medicine. But the problem is that medicine for osteoporosis, and many of us can accept the fact that hypertension, diabetes, I agree, I need treatment for life. For a heart problem, yes, I need medicine for life. For osteoporosis, what? I need medicine for life? You sure? And all this medicine are meant for what? It reduces bone loss. At the same time, some medicine helps you to build bone. So to bring a negative balance back, right? So you got to patch up the bone. At the same time, you cut down the bone loss. So if you have osteoporosis, by taking calcium vitamin D alone, by drinking milk alone, is definitely not enough. You need medicine. Of course, what medicine to choose, your doctor will actually look at your profile and decide which is the best for you. We not really divide them into bone forming medicine or those medicine that reduce bone loss. Of course, all this medicine, some of them do have some side effect, but you have to weigh against the possible side effect and the beneficial effect. But stress a point, osteoporosis need to be treated and you need a long-term treatment. At the same time, you monitor the bone density, monitor any new history of fractures and so on. All these things, the doctor will actually remind you of all this. So don't be surprised when osteoporosis, you need long-term treatment, lifelong treatment. Okay. So what medicine to choose, your doctor will decide for you. And so, as I say, ultimately, we want to prevent fragility fractures. And OASKLS, since we actually formed the society for the past 11 years, our idea is to promote healthy bone for life for all Malaysians. That's why we've been traveling everywhere. And we were promoting healthy bone for life, start from an expecting mother. Okay. And bone health doesn't start when you're 40 years old, when you have fractures at 80 years old. Bone health, we always promote from an expecting mother to a newborn baby and all the way to our toddlers, our young generation, and not to forget even they are 90 years old, 100 years old. So the concept of healthy bone for life is something that OASKLS always promote. Why is that so? You diagnose, you see a risk, whether you develop osteoporosis or not. From there, you need treatment, and then to prevent fractures, the fragility fractures. That's all on my part. And so we have further questions later when Dr. Tan and Jason present their part. Okay, so we enjoy this journey at 20 minutes. Thank you.
Thank you, Dato. Thank you for the insight, knowledge about osteoporosis. I guess end of the day, right? We just got to start taking care of our bones from very young age. And I think also lifestyle plays a big part in strengthening our bones.
Yeah.
Thank you. So the next speaker that we have is Dr. Tan. Dr. Tan will talk about preventing fall prevention. We would like to hear what Dr. Tan have to advise us. Dr. Tan?
Good afternoon, everyone. Thank you for joining us. I hope, is Henry there? Would you mind please sharing my slides? And I think it's ready to go.
Yes, I'll give me a minute.
Thank you very much. Yeah, and happy to take questions later as well. Falls prevention is really important, not only just treating osteoporosis, but preventing falls is also a main way of preventing fractures. Okay, there we go. Thank you, Henry.
Good afternoon, everyone. Thank you for joining us today. I would like to speak on how to prevent falls and fractures in older persons. Osteoporosis is really a silent condition until a fracture occurs. It gets more common as we grow older. How often do older people fall? Up to 30% or 1 in 3 of those aged 65 and above fall at least once a year. And 50% or about 1 in 2 of those aged 80 and above fall at least once a year. Of all these falls, 5% or 1 in 20 can lead to a fracture and or hospitalization. Falls and fractures can lead to many consequences. For example, admission to a nursing home, chronic pain, depression, complications from prolonged bed rest such as pressure ulcers or bed sores, inability to perform activities of daily living such as cooking, showering, going to toilet independently, reduction in quality of life and increasing physical frailty. Worry or anxiety about falls, future fractures, and potential for going into a nursing home. And there can be a financial burden on patients and caregivers, including lost work days and salary. There can also be the mental burden or carer stress of looking after a very dependent older person. One of the major fractures that can happen to an older person who falls is a hip fracture, as shown in this diagram. What are the long-term consequences of a hip fracture? Up to 1 in 4 could die within a year. 1 in 5 may be semi or fully dependent on others for their personal care. 2 in 5 will have reduced mobility compared to before the fracture. And 1 in 4 may be living in a nursing home after their hip fracture. What can happen to an older person who has fallen? There could be muscle or soft tissue injury with bruising. There can be something serious called a subdural hematoma or bleeding outside the brain lining, as seen by the CT scan of the brain on the right-hand side of this slide. There can be also intracranial hemorrhage or bleeding inside the brain. There can also be a prolonged loss of confidence or what we call fear of falling, leading to self-limitation of activities. For example, the older person would prefer to stay at home instead of going out with family and friends for fear of falling. And this can lead to social isolation and anxiety and depression. No two older persons are the same, as shown by these photographs of older people. An older person could still be very fit and very active, ranging to an older person who needs help with their daily activities, living in a nursing home. This clinical frailty scale nicely illustrates the range of fitness or frailty of an older person, ranging from number 1, very fit, to number 8, very severely frail. For example, in the previous slide, we saw a photograph of an older female gymnast who was on parallel bars, and she would be in the number 1, very fit category. When a person is well, if a hip fracture occurs, they can very quickly graduate up this clinical frailty scale to, for example, mildly frail or moderately frail. So prevention of falls and fractures is really worthwhile. What can cause people to fall? There can be external factors or internal factors. First of all, I will go through the external factors in the following slides. There can, for example, be uneven ground or a wet surface or wet floor. There can be trip hazards around the house, including loose carpets and rugs. There can also be wires from computers, phones, and other household appliances. Staircases or steps can also be common areas of fall. The picture on the right shows dark steps with no lines that differentiate between the steps. The top picture shows a beautiful staircase without handrails. The middle picture shows a step between 2 parts of the same room, and frequently many older persons may not be aware of that step, or they do not lift their foot high enough to clear that step. The bottom picture on the left also shows several steps between the kitchen going into the living room without any railings. Toilets, if a person has to lean too far forward to reach the toilet paper or the hose, this can be another potential risk factor for falling. Also, if there's a slippery floor in the bathroom or toilet, that's another risk factor for fall. If the lighting is too bright or there is a glare, or if the lighting is too dim, this may also increase the risk of falls, especially in older people with poor vision. Inappropriate or unsafe footwear or shoes can also increase risk of falls. For example, slippers that easily slip off the feet, inappropriately high heels or narrow-based shoes. And we've also had older people whose slippers or sandals get caught when they step up a curb or are going downstairs. Now let's go through a few internal factors which can cause a person to fall. And by internal factors, we usually mean there are multiple medical conditions, frailty, poor balance, or any other conditions that they may have. Here are a few of the chronic or long-term medical conditions that an older person may have that can contribute to falls. If a person has osteoarthritis or narrowing of the joint space, this can cause chronic pain, and a person with chronic pain may not walk about very much for fear of pain. This can lead to muscle wasting and poor balance in the long term. A person with low red blood cells or a condition called anemia can also feel weak and tired and more unsteady when they walk about. A person who has diabetes for many years may suffer nerve damage and also blood vessel blockage that can lead to ulceration and amputations. There can also be neurological conditions such as a stroke or Parkinson's disease leading to poor balance and weak muscles. And a person with dementia may also have poorer safety awareness, thus increasing their risk of falls because they are not so aware of their environment anymore. An older person is also more likely to have a condition called sarcopenia, where their muscles are weaker and more shrunken compared to when they were younger. This can happen over many years gradually due to reduced level of physical activity and poor nutrition. Older persons are also more likely to suffer from dizziness and blackouts. They may have a condition called postural hypotension, where their blood pressure drops on standing from a sitting or lying down position. An older diabetic on many diabetes medications may also be more likely to suffer from low blood sugar, leading to unsteadiness and tiredness and increasing risk of falls. There are also older people with seizures or epilepsy, and when a seizure occurs, they may also fall suddenly and injure themselves. Urinary problems can also increase risk of falls, especially if the person has urinary incontinence, where they have to rush to the toilet urgently when they feel the urge to pass urine. There are also older people who wake up several times at night needing to go to the toilet to pass urine, and frequently some falls can happen at this time. Visual problems or poor eyesight can also contribute to falls, including cataracts, glaucoma, where there's high pressure inside the eye, and also macular degeneration, where there's damage to the cells at the back of our eyes. Low blood pressure can also be a cause of falls. What are the causes of low blood pressure? In a few older persons, they may be on too many high blood pressure medications. For example, every time an older person goes to the doctor's clinic, his or her blood pressure may be falsely high because he or she was rushing and slightly anxious about seeing the doctor. We usually advise an older person with high blood pressure medications to check their own home blood pressure several times a week in the afternoon when their medications have been fully absorbed. We want to see how low the blood pressure goes. And if we find that the blood pressure does get very low after taking medications, we will gradually reduce the medication dosage bit by bit. On a hot day, when an older person is perspiring a lot, and if they do not drink enough water or liquids, they may also suffer low blood pressure. There is also a medical condition called Addison's disease, where there is not enough steroid hormones in the body, leading to low blood pressure. What can we do for falls prevention? We will review the risk factors of each person to see if it is modifiable or can be changed or improved. Many people play a role in this, including the doctors, nurses, family members and carers, physiotherapists, and occupational therapists. The doctor can review medical conditions that we spoke about to see if treatment is required. For example, if there was arthritis, he can determine what is the severity, if there's muscle wasting and poor balance. Then the doctor can refer to the physiotherapist for rehabilitation, prescribe adequate painkillers, and refer to an orthopedic surgeon if required for surgery. If there was presence of poor eyesight or vision, the doctor can refer to an ophthalmologist or eye specialist. The doctor can also reduce medications if the blood pressure is too low, find out what the cause of anemia is, whether there's any blood loss, reduction of blood cell formation, or increased blood cells destruction inside the body. And if there was presence of Parkinson's disease, determine if the medication dosages are optimized and also the timing of medications. The physiotherapist can teach muscle strengthening exercises and exercises to improve balance and gait, which is the way the person walks. He can also assess for appropriate walking aids, such as whether a stick, a quadruped, a frame, or a rollator is required. The physiotherapist can also teach strategies on how to get up safely after a fall. The occupational therapist can perform a home visit and assess the home environment to look for falls hazards. They can advise on removal of trip hazards, recommend appropriate grab rails and equipment, and also suggest perhaps a panic alarm or wearing the hand phone so that the person can call somebody after they have fallen. Nurses and carers can also be aware if the person they are looking after is at risk of falls. They will have to think about all of the above. If the patient is in hospital, they will be advised to use the call bell if they wish to go to the toilet, for example, or use a bedside commode or toilet chair for toileting so that they don't have to walk so far. The ophthalmologist can check for the presence of cataracts, retinal problems, or glaucoma, and appropriate treatment can then be prescribed. A word of caution about multifocal spectacles. If it is used inappropriately, it can lead to falls, especially in the beginning when the person is just learning how to use them, because they have difficulty differentiating depth when they are looking down, for example, when going downstairs. So be very careful if you're just starting to learn how to use multifocals. An older person who is at risk of falls should actively see their doctor to screen for osteoporosis. Don't wait for a fracture to happen. The doctor can arrange several tests to check for osteoporosis. If a diagnosis of osteoporosis is found, the treatment would include seeing a physiotherapist for the muscle strengthening and balance exercises, a good diet, calcium and vitamin D pills, and several different treatment options that can be chosen according to the characteristics or preference of the person. What should be done when a person falls and sustains a fracture? The person should seek medical attention as early as possible, because complications from an untreated fracture can be very serious, including prolonged pain, a DVT or PE in the legs and lungs, which results from prolonged immobility. These are blood clots that can cause very serious problems, including death. There can be development of pressure ulcers or bed sores, pneumonia or chest infections from lying in bed all the time, depression, and increased risk of death up to 50% at 1 year, and this is especially higher in men. Rehabilitation is required after surgery. The person then should be mobilized as soon as he or she is allowed, for example, sitting up and sitting out. The longer the person is in bed or immobilized, the more the muscle wasting will be, and the poorer the person's balance will be. An appropriate walking aid should be prescribed, and there should be carer training for safe transfers. In summary, osteoporosis is more common in older people. It is a silent condition until we fall and fracture. We aim to remain well for as long as possible with healthy aging. Falls prevention strategies are very important. It is also very important to screen or check for osteoporosis before the first fracture occurs. A person should go to hospital immediately if they suffered a fracture. Thank you very much for listening. Happy to take questions later.
Thanks. Thank you, Dr. Tan. Well, it looks like it that there are a lot of things that we can control ourselves to prevent falls. You know, like
That's right. Yes.
yeah.
We must make a conscious effort to be mindful, assess whether ourselves or our family members are at risk of falls, and go through all the aspects that we spoke about just now in the talks. Yeah. So it's a conscious effort to prevent falls.
Yeah. Thank you so much, Dr. Tan.
You're welcome.
Okay, we have our last speaker, Mr. Chan, who will explain to us about the types of exercises recommended to strengthen our bones.
Okay. Now, good afternoon, everyone. Welcome to our sharing session. So I hope everyone is doing well and staying safe at home. Okay, so my name is Jason. I will be your physiotherapist sharing on what exercise you can do to help strengthen your bone. Let's go to the next slide. Okay, when people often ask me, why do we need exercises? The answer is often simple. The benefits are it helps you to maintain optimal physical and body function. So over the years, there are many studies showing that it is good for your bone health. Now, if you can look at the chart on the bottom left here, you see that it's a body function chart against age. So generally, an active person is able to stay healthy and functioning longer than a non-active person. Okay, now aging population has been increasing in Malaysia, so about 65 years old and above. It's increasing more. Last year was about 6.7 and this year is close to 7%. As we age, there will be some physiological changes happening to our body. As you can see on your right, their muscle mass will become smaller, their muscle will shrink. So the flexibility of the joint and muscle will somehow reduce. They would have also a poorer balance, leading them higher risk to fall. We also note that their coordination, the stamina, and the reaction time would reduce as well. Now, as we see here, the chart has been shared by Dr. Lee earlier on. It's by the association of aging and menopause. Okay, osteoporosis somehow happens among younger men and women as well, as we see that peak bone mass often reaches when we are in our early adulthood and gradually late or our okay. So next question they often ask me, any difference of physical activities and exercises? Of course, I would say yes, there is. I will help them understand this by looking at the chart on the left. Now, physical activities are any movement carried out by your muscles to move around that requires energy, such as your house chores, walking from point A to B, sitting up, standing, and all. So when we talk about exercise, within physical activity, part of it is exercise. And exercises consist of different categories such as balance, the strength, the stamina, which is under the aerobic, and also the flexibility. Okay, so exercise is more like a planned, structured, repetitive set of movement done to target certain functions. Okay, next they will also ask me, am I already exercising enough? How much exercise is enough for me? Now, to understand this, I will have to go to the next slide here. Now, if you can see on the pyramid there, the bottom part of the pyramid is where you do most throughout your daily life, and the top is what you are encouraged to do least. Now, daily activities are those like your house chores, moving around, standing. Those are physical movements. They are not exercises. Now, if you look up, higher up the chart, we have moderately intense cardiovascular exercise. So it is often suggested that we do about 30 to 45 minutes, 3 to 5 times a week. Those includes your brisk walking, your cycling, your aerobic exercise, as well as your hiking. Okay. Higher up, slightly up, includes your strengthening and flexibility exercise, which is needed about 30 minutes, encouraged to do twice a week. And the top of the chart, we have the more sedentary, which requires less movement, such as your TV, your board game, readings, and all. Okay, now, how do we monitor when that exercise, where we say it should be moderately intense? As suggested, there are two ways. First, on the left, we can see, we can calculate using the heart rate. Look at the table here. We have that green zone, which I put here about 60%. So this is 60% of the maximum heartbeat that your heart can sustain. Okay, so all these are estimated figures calculated using a formula. So I put it into groups where you have the 30s all the way up to 80s. Okay, then second way is that we use the rates of your exertion. How much exertion are you feeling? So we look at the top right, we have a cute chart there with a emoji. So what we are aiming for is about 5 to 6, which is the green zone. So it's moderately intense. Now, how do we say moderately intense? So for an example, we are doing a slow jog, all right? So as you're doing slow jog, what you should feel, you're feeling a little exertion. You're feeling that jogging, wow, it's stressing you out a little bit. You start to feel a little warm, start to sweat a little. But if someone were to talk to you, you are still able to answer them without actually feeling too much out of breath. That is the rate of exertion you should be looking for when exercising moderately. Okay, next up, are there any considerations when they say, oh, exercise, before doing all these exercise, are there? Yes, there are a few, especially first, you need to know your fracture risk. So people who are at high risk fracture, certain exercise are not suitable for them because they need to avoid stressful movement, such as your trunk bending, your rotation, your twisting. Always consider the impact of the exercises. When you exercise, consider the rule of thumb, consider the FITT, the frequency of your exercises, the intensity, how intense is it, what kind of exercise, the type of it that you are doing, and the time you do your exercise. Time as in not morning or night, but how much you do it, how long is the duration, that's considered the time. Always consider your warm up and cool down. All right. Now, always take note, disclaimers. Always be aware that not all exercises are suitable for everyone. So if you have medical issues, definitely the exercises prescribed will need supervision. So please consult with your doctor and certified health professional before engaging in exercise program. If you feel discomfort or pain, kindly stop. And it would be very helpful if you could know your risk factor. So physiotherapists or any trainers can help you choose the most appropriate exercises for you. Not too much, not too less. All right. Now, simple equipment that is easy to get, quite helpful for your exercise regime would be such resistant bands, where it's those stretchy rubber bands, towel or a stretch band, a long towel, weighted bottles, or just a simple dumbbell would do. When we talk about warm-ups, I have some of the moving pictures to help you all understand it a little better. Okay, now warm-up, what are considered warm-up? So consider it as moving your joints from the top to the bottom of your body. It's a message telling your muscle, hey, wake up, get ready, we're about to do some movements. So recommended that you do the warm-up for about 5 to 10 minutes, optimally until we start to feel a little sweat, the body starts to warm up. Okay. Now, as for strength exercises, noted that these two exercises are more to the posture. Now, as we mentioned before, osteoporotic patients tend to slouch a little more, giving that hump. Okay, so these chin tuck exercises and shoulder retraction exercises will help in your posture. For the first one, the chin tuck exercises, kindly lie down and tuck in your chin towards your chest. What you should be feeling is that activating at the front of your neck, and you should feel a little stretch at the back of the neck. Okay, so hold it for 10 seconds, repeat as shown. For shoulder exercises, the next one, what you do is you tighten and squeeze your shoulder blades together to pull your chest open. Okay, so what you should feel here is the muscle in between the shoulder blades. Next up, we will see this slide. This is a spine of a normal person. Elderly, when they tend to slouch a lot in this posture, not good for the spine. Bending forward gives a lot of compression to the spine and it might collapse. So that exercise might help to keep you a little more upright. Next up, a little exercise for the arms. There are choices that you can use. Either you can use a resistant band or some light weights. So keep your back straight, stabilize the shoulder. What you need to feel is the front muscle working here at the front of your arms. We call the biceps here, the front of it. So bend your elbow against the resistance, slowly up and slowly down. Do not let the gravity pull you, just control the weight. Next one, it's the exercise for the tricep, which is near the back of your arms here. What you can do, you can hold the weight nicely. Make sure you hold it nice and firm so that the weight doesn't drop to your face. Okay, hold and repeat as shown. Next up, if you're considering to work on the exercise for your lower thigh, you have two here. Up is the bridging exercise. Make sure to keep both your feet at hip width apart. Should stabilize your lower back. When doing this exercise, you should feel more on your buttocks and the back of your thighs. So when step against, using your feet, step against the couch to lift your buttocks up, not to use your neck and your upper back to push against the couch. So if you consider to make it difficult, more difficult, you can use one leg. So you can hold it there before coming down again. Now the next one is something we call the straight leg raise. Focus more on the front of the thighs. Imagine yourself tightening your thighs at the front before lifting it right up in the air. You could put one leg up to stabilize your spine here. Okay. Next, we have the exercise called the clamshell. This exercise mainly works on the side of your buttocks. Okay, this muscle here is very much needed for your stability when you walk. Okay, so when you do this, you lie on your side, make sure your spine and hips are aligned. Then you tie just a resistant band above your knees here. Imagine you're opening up like a clamshell. Push against the resistant band. You should be feeling a lot on the buttocks, the side here. So hold before putting it down. Next, on the right, some muscle exercise for your calves. So keep a steady chair in front of you just in case you lose your balance. Okay, then you do put your feet hip width apart, slowly lift your heels up away from the ground. Hold it there 10 seconds and you repeat once or twice in the day. All right, we included some simple stretching and mobility exercise to keep your muscles and your joints flexible as well. Now, simple one, I think people are familiar with this, are towel stretches, where you kind of hold the towel with one arm up behind your back and you stretch it by straightening the other arms. So this would kind of stretch out the arms and your back muscles. Next one on the right is where we do that overhead stretch. Put both your arms towards the ceiling and gently tilt your body from side to side. So do not include any trunk rotation because that's going to give too much stress on your spine. Just control gently, do not use momentum. Hold it there to give out a stretch and repeat a few times. Next, it's something for the neck and the front of the chest. So hold the side of your head and move it to the opposite side. You may use your hand to kind of give a little overpressure. You should be feeling a stretch around this muscle here. Can you see my mouse here? Okay. Now, the next one. This exercise, the stretching feeling should be felt around the front of your chest and the front of your neck. So squeeze your shoulder blades tight, move it behind and hold it there. Okay. Next one. a little stretching exercises for the front of your thighs. As you can see the picture on the left, you see that man doing this position. So often people will ask me whether they can do it while standing. Yes, you can, but it challenges your balance a little bit. So people who have low stability or poor balance, I would recommend them to do it lying down, safer this way. So lie on your side, make sure your head is well supported, keep the trunk and the hips aligned, then gently pull back your knee towards the buttock, okay, and hold it there. Now on the right side, it's a stretching done from the back of your thighs. It's called a hamstring. So you can use a towel, a stretch belt, a yoga belt, whichever you have, put it at the base of your foot. And as you lift the thighs up at 90 degrees, slowly straighten your knees. You should be feeling stretch at the back of your thighs. So imagine yourself straightening up your feet, pointing towards the ceiling. That will be stretching it out. Okay, so when it comes to other activities, people say, can I still continue my activities even if I have osteoporosis? Definitely yes, because we need all these activities. Different activities would help to carry out different function. Now, these are the top-rated beneficial exercise that people tend to do for older people or people with osteoporosis. Now, brisk walking, jogging, or running. I would want to note down that it's good to know your fracture risk before starting to run, but brisk walking is always a good option. So all this, it gives mechanical loading to the bone, good weight-bearing exercise to stimulate the bone growth. Next up, what we have, hydrotherapy or pool exercises, or consider it as swimming. Okay, so all these activities high risk of fracture. So water, the molecule from the water reduces the impact to the bones. It helps the muscles when they have resisted slopes in the water. Aerobic exercise is for cardiovascular fitness, generally good for your stamina. It's great for warm up as well, get your weight. Next up, we have things what is known as Tai Chi. So Tai Chi has been shown to be quite good at improving your balance because they have movement which includes slow movements that challenges your control and balance. So they practice on slow and steady movement. So that will be a good option. Last but not least, many papers have shown to be good. They encourage you to do dancing. It's basically good for your brain and it makes you happy, slows down degeneration of the brain. Most importantly, when you dance, you practice your coordination. Okay, so these are the few things I would want to wrap up. Consider doing exercise. It's good for you. Now, that's all from me. Thank you very much.
Thank you, Jason. Well, actually, the exercises look so simple, and it's just a matter of a mindset to really get ourselves to do things like that. Thank you so much.
Okay.
Now we're open to the floor for any questions that you may want to ask any of the panelists. Please do type your message, your questions either here or on the Facebook page. Any questions, anyone? That you would like to inquire something that's in your mind bugging you about osteoporosis or to do any of the exercises? The panelists will be more than happy to answer your questions. Oh, Dr. Terence Ong. Can I do anything for my bones during MCO? Jason?
Can I do anything for your bones during the MCO? Definitely, those exercises they kind of give a mechanical loading to the bone and stimulates your bone growth. So it's encouraged to stay active, even though during the period of MCO, there are many exercises you can find on YouTube. But as long as those exercises are not too much of high risk, they are all right. So keep your muscles strong, give some impact. When I say impact, it's something like your weight-bearing exercise, like running, jogging, dancing, all those are good.
And I think those exercises that you share can also be easily done in the house, right, Jason?
Yes, those are actually some home exercises which I usually prescribe to people that are kind of occupied and they can only have time to do exercise back at home.
Okay, we have another question by Vivian Tay. May I ask exercise, is it best to do it on hard surface instead of on bed?
Those exercise, I would recommend to do it on a firm surface. Any yoga mat would do. Sometimes the bed really depends on the density of the bed. It might be too soft, then you might sink in. When you sink in, you won't be keeping your spine so stable. So as long as your bed is kind of firm, you can do so. If it's not firm, you can consider moving it to a yoga mat.
Okay, another question from Siu Sui Ha to the doctors, I guess. What is the suitable dosage for calcium and vitamin D? Datuk, Dr. Tan?
I think that depends on the calcium, vitamin D, the requirement. I think that's the first thing we need to understand. At a different age, you need a different amount of calcium or vitamin D. Let's say a young man like me, and
Very
calcium daily requirements about like 800 to 1,000 milligram a day. My vitamin D requirement daily might be 800 international unit a day. All right, but in elderly osteoporosis, they might need about 1,200 milligram of calcium a day or 1,000 to 1,200 IU vitamin D a day. So different age, you have different requirement. And the important thing is from the natural sources, you meet the requirement. Your intake should meet the requirement. But just now we put a point where some patients come to us with severe vitamin D deficiency. From blood tests, you actually see vitamin D deficiency. So a patient like that, you need a high dose, very high dose. You might even come to about 25,000 international unit vitamin D every week or every 2 weeks or even twice a week. But it all depends on age, requirement, and whether you are at a deficit level that you need to actually push back your vitamin D level to a certain extent. So that's why different condition you need a different so-called amount rather than dosage of vitamin D or calcium that we need.
Thank you, Datuk. We have another question by Chin Sun Sia. Is drinking mineral water with high calcium, sodium, and potassium good for our bones and muscles?
Dr. Tan, you want to answer that?
Dr. Tan?
I think that probably from mineral water, no, I don't think so. I think the calcium and the minerals need to come from natural food. So natural food is best. We can't possibly be drinking so much mineral water that has so much calcium in it and sodium and potassium that it can make much difference to our health. Yeah. So better to drink enough liquids, not just plain water. Older people need solutes as well. I think that's where the question is going. And Chinese people like to drink soup. There's lots of solutes in soup, barley water if you're not diabetic. And then the calcium, vitamin D intake from natural food. And if insufficient, can take supplements then thereafter. And the general rule of thumb for an older person, 1,000 international units of vitamin D per day. Traditionally, they used to say 1,200 milligrams of elemental calcium, but then there were some reports that too much calcium may not be good for the heart and cause heart attacks and calcification of arteries. That's not been fully proven because it's just retrospective observational studies. But nonetheless, having a little bit of calcium supplementation, a few hundred milligrams per day, elemental calcium, plus the rest of the calcium from diet would be good. Yeah. So don't feel obliged to buy mineral water. Just drink normal liquids. and get the minerals from food and drink, natural food and drink.
I was just about to ask you a question which you have answered about the excess of calcium. There's one question to Jason from Ong Kim. Can I continue playing tennis even though I have been diagnosed with osteoporosis?
Okay, that is a good question by this Hong Kim. Thank you for asking. Okay, when we talk about whether you can continue to play tennis, it really depends on the severity of your osteoporosis. That's one. Pre-existing conditions such as your knee pain, your joint pain. So as long as you are playing that tennis, it's considered as quite a high impact sport, depending on how you play it as well, whether you are playing gently or you're really all out into chasing the tennis ball. Be a little careful. As long as it doesn't cause you any pain during or after your play, that is
Oh, I think Jason is frozen. There's one question to Dr. Tan. We move
yes,
on, we come
can
back
you
to
all
Jason.
hear me?
We lost you a little bit, Jason.
Okay. Oh, okay. Which part? Am I
About the
stable now?
severity of the osteoporosis.
Okay, as I continue, yeah, it really depends on the severity of the osteoporosis that you are having. So as long as you are playing pain-free, it is always good because tennis is considered quite a high impact sport. You really have to see whether you have pre-existing conditions, any disease that you should be taking care of, or any joint pains that you previously had. So this might actually cause it to worsen. So otherwise, if you're not having any pain, you can just go ahead.
There's one more question for you, Jason. What kind of exercise is best to help reduce osteoporosis in the hip?
General exercise, I think would be good. No specifically saying that cater to the hip itself, because as you do exercise, that force, the impact goes throughout your bones. As you weight bear, it goes throughout. So it would stimulate the muscle growth and also stimulate that bone growth.
And Ms. Chu, on the exercise, can I comment on the orthopedic point of view?
Yes, please.
And
Dato'.
we understand that many of us don't do regular exercise at all. The only exercise you do might be blinking your eyes every day. Okay, that's an exercise. So don't, after today's session, and you've never done exercise before, and then you start running around in the slopes and hill, the garden, the park that you have next to your house. You have to really tailor the exercise according how you feel. You have to listen to your joint, particularly your knee. 60, 70, 80, many of us already have some arthritis of the joint, and you never done exercise, and now suddenly you go to pound on the knee, you go to run up down slope because Jason tell me, Dr. Lee tell me, and Dr. Tan tell me to do so, and then you come back 2 days later, you come back and say, oh, my knee are very swollen and painful. So tailor exercise accordingly, from a minimal then gradual step up. Always protect the joint. Even some of you have a knee arthritis and pain, and so you like to go for walking. It's actually advisable even nowadays. You buy that trekking stick, the one pair that you hold. You actually walk with that, like skiing, and that helps a lot in terms of reducing loading on the knee and the back. Otherwise, you suddenly jump into exercise, you do excessively, and next thing you have to see me at the clinic with knee pain and swollen knee. Okay, so be careful on that.
I think you have to listen to your body as well.
Correct.
Yeah. There's one question to Dr. Tan. Public parks have uneven floors, slippery floors. Parks are very unfriendly for older folks. How can we get the relevant authorities to seriously look into this?
Yeah, that's a difficult one. I mean, we would expect that if we report to the local county council, which is the Majlis Bandaraya or Majlis Bandar or the town council, that some action will be taken. That would be the normal way to do it. Otherwise, a complaint on social media as well nowadays gets done very quickly.
That's a reality.
Yeah,
I think the maintenance of the park is a reality.
But in Malaysia, not many people sue the government or county council for not maintaining. So it's a very tough thing.
Yeah. Yes.
I agree. It's very difficult. Maybe it's from Miss Celine Fernandez. Have you any suggestions yourself on how to get people to act on that? Yeah.
I think also as frequent park users, we got to be careful ourselves.
Yes, have to be on the watch out. Yeah.
Yeah. There's one
For
question-
mosquitoes as well.
Yes. There's one question on Facebook. Teo Su Xian. I've been asked to take Prolia 2 times a year. Is there a substitute as it's very expensive?
Now, I'll take that.
Yeah, thank you.
Medicine for osteoporosis, we broadly divide into 2 types. One is called bone forming agent. Another one is called anti-resorptive. Anti-resorptive means something that reduces bone loss. And one of the commonly used ones is actually called this Prolia, or in fact, the name is called denosumab. And denosumab actually injected subcutaneously, 6 monthly, and the medicine protect you for 6 months. Then after 6 months, you need to have a second injection and subsequent injection. It reduces the bone loss even more than 90%. So that way that actually reduces the bone loss. At the same time, you actually build your bone. So medicine actually shown to improve the bone density, bone quality, and more important is to reduce the fracture risk. It is one of the common medicine that we use in clinical practice, convenient, just 6 month injection, but you must accept the fact that you need to have a lifelong injection because that medicine only protect you for 6 months. And of course, there are other medicine like a group called bisphosphonate, tablets that you take weekly, monthly, or some actually infusion once a year. Those medicine also meant to reduce bone loss, because anti-resorptive. And so your doctor will actually see your profile, as I say, your background, and which medicine suits you best, which is safest, and at the same time can actually achieve the best result on you. So there are some medicine, but whether are you suitable to actually use the other type of medicine or not, that really depends on the discussion between yourself and the doctor. Your doctor needs to understand your issue. Cost-wise, it's not too expensive compared with the tablets that I mentioned earlier. You say divide into monthly, it's about the same, the 100 plus a month. So that's why talk to the doctor. There are substitute, but whether that actually suitable for you compared with this injection denosumab.
May I add in there, Ms. Chu and
Yes,
Datuk
yes,
Lee,
Dr. Tan.
that the injections, if the person can afford it, it increases compliance. Then the person doesn't have to remember to take the weekly tablet called alendronate. But of course, the daily vitamin D and calcium should go on. It's not that just take the injection and then don't take the calcium and vitamin D. They go hand in hand. Vitamin D, it can be a daily dosage, and some people are rather non-compliant. They'll forget the daily dosage. And I've seen patients go on, for example, 50,000 international units once a month in powder form, or 25,000 international units. And then the daily calcium that comes from the diet, or a small calcium pill daily as well. Now, for older person with swallow problems, some of the older forms of alendronate, it's not suitable for older persons with swallow problems. If it gets stuck when they are swallowing it, it could actually cause an ulcer on the way down if the tablet dissolves halfway down your esophagus. And for people on a feeding tube, we mustn't crush that tablet called alendronate. It's not a tablet that should be crushed. But I believe there are newer forms of this weekly alendronate that may be dissolvable. You know, the drug companies are always coming out with newer formulations of a certain drug. Yeah. So talk to your doctor, and doctor usually will check your kidney function as well before deciding which of the medications to prescribe for you.
Yeah, Ms. Shu, at this juncture, I think since you talk about medicine, let's relate to the MCO. That's a very important point here. And we noticed that during MCO for the past 1 year, many patients do not come back for the refill. Many of them, they do not want to come to hospital because they're scared to come to hospital. So the compliant adherence actually has dropped significantly during the MCO period because you're scared to go to hospital or to your doctor. And that's not only in Malaysia, it happened everywhere. So that actually proves the treatment compliance adherence down. And in fact, that increases the risk of fractures as well. So there are many different ways that the doctor can actually help you. One, your doctor can actually sign a prescription for you, and the prescription can be actually WhatsApp to you or email to you or whatever way. So you have the prescription. You can go to the nearest pharmacy or your GP, your doctors, family doctor. You don't have to come to hospital. Get the refill or even get the injection by the nearby GP, family doctors, buys the tablet from the nearby pharmacy. And also sometimes when you need to come to the hospital, and of course doctors will always give you a letter issued from the hospitals to certify that you need to come back for some injection or treatment. So don't stop treatment for your osteoporosis because of MCO period, because that actually increase the chances of fracture or increase the fracture risk related to your non-compliant. So there are many ways doctor can help you continue your compliance and your adherence for the treatment. That's important.
Yeah, I agree. I think the continuance of the medication is important. There's another question. Please elaborate on the stressful movements to be avoided for a person with osteoporosis. Jason?
For my side, for the spine, you need to take care of the spine where you avoid forceful rotation, combining with bending forward or twisting. Perhaps Dato' Lee would have any advice for the patient to avoid the stressful movements?
I think in many elderly, you already have osteoporosis under treatment. And one way you have to watch when you want to lift anything from the floor, big, small, heavy, or light, we do encourage you to squat down and pick it up rather than bend forward repeatedly to lift it up. And we do see patients have sudden severe back pain because they're doing gardening. They're cleaning up the the flower pots and all those things in the garden. So they actually sustain a sudden fracture, compression fracture of the spine because of repeatedly bending forward. So it might be safer for you to actually squat down to do anything, to pick up anything from the floor. But saying that, you also something contradicting, because when you reach certain age, 60, 70, you might have knee pain, right? So you squat down, you aggravate your knee pain now. But you don't, that means you want to protect your spine, you need to squat down to pick up things. And then you sacrifice your knee, you might get knee pain. But if you want to protect your knee, you have to bend forward to lift things. So this is reality that, in our elderly patient, they do have this issue. So you have to really balance between the spine and the knee. Okay?
Can I please add in something there about the sudden movements? As a geriatrician, now these are very rare cases, but I just like to bring it up. We've had patients where they went for very severe massages or uruts or bone setter. I think the Chinese term is tita. And I'm sorry to say that I think there had been some fractures, but those patients must have had very, very, very thin bones. So be very careful. Another case that we've seen would be a fully bed-bound, frail person, and on care needs, like turning the person to change their clothes or care for them, sudden crack. So have to be very gentle. If the person is bed-bound for 3, 4, 5 years already, we do have patients like that. Their bones would be much more osteoporotic because they're not upright and walking around. When we're standing upright and we're moving around, we are also stimulating our bones and bone and strengthening it. So being bed-bound, they're not putting any weight on their long bones anymore. So the bone gets even more porous. Yeah.
There's one question from Lillian Lee. My bone density scan shows that I have osteopenia. Do I need medication?
You have to pick it up, Tan?
Oh, yes, osteopenia. So we have to look at everything together, whether the person is at increased risk of falls, what's your diet like. In general, the knee-jerk response would be osteopenia. No need to go on full osteoporosis treatment yet with the weekly tablet or the 6-monthly injection, but instead concentrate on boosting the vitamin D and calcium level, measuring them and doing exercises, strengthen the bone, a good diet, no smoking, etc. But if a person's scan says that they have osteopenia, but they already suffered a fracture from a low-level fall from a standing height, then the person is by definition osteoporotic already. So I've seen the mistake where somebody already fractured a wrist, went for the bone density scan, somehow the doctor found that it's osteopenic, not osteoporotic. Osteopenic means slightly thin, osteoporotic means porous, then the person doesn't go on full treatment. So if it's osteopenia, you need to discuss with your doctor what level of treatment do you need? Do you need the extra calcium vitamin D pills, or can you do with just exercise and a good diet? In general, most people will get a little bit of calcium, a little bit of vitamin D supplementation when they have osteopenia.
Yeah, for the benefits of others, osteopenia means that you measure bone density. There's something called T-score. A T-score in the range of -1 to -2.5. That's actually called osteopenia. Remember the one point I mentioned, one slide mentioning about the fracts. And some patients, they do have osteopenia. They might be -2.3, but yet they're still osteopenia. No, they're not osteoporotic yet. But as Dr. Tan mentioned, this patient had history of fracture before. But this patient had other sort of risk factors that increase the fracture risk. So patients like that do need treatment for osteoporosis, because there are many osteoporotic fractures or fragile fracture happen in the osteopenic range rather than osteoporosis alone. So that's why Dr. Tan actually brought the very important, you have to look at a patient as a whole, not only the number of osteopenia alone, you have to look at the risk factor associated, which actually increase the FRAC score or the risk of fractures, the prediction of the fracture risk in the next 10 years. So all these things we take into consideration before we actually start someone on a long-term treatment. That's a principle there, rather than just based on a number of osteopenia alone.
Another question on Facebook, Sally Ng asks, what is elemental calcium? Can the medication Dr. Lee mentioned able to build back lost bones?
Let's say, okay, Kiman, go ahead.
Oh, so sorry. I think it was myself who made the term, who said
Elemental,
the term
that's
elemental
right.
calcium.
Yes.
I'm so sorry without elaborating. That's terrible. I'm so sorry for that. Now, when you buy, when you're prescribed a medication, the calcium comes in many forms of salts, calcium carbonate, calcium lactate, for example, and they have different amounts of calcium in it. So this is going back to our chemistry. Calcium carbonate has a fair amount. I think if you prescribe 1,500 milligrams of calcium carbonate, you will get 600 milligrams of elemental calcium. So traditionally, when I was working elsewhere and we had the big Caucasian people who weighed 60-something, 70 kilograms, here I see many 40-something, 50 kilograms patients. They would be prescribed 1,500 milligrams calcium carbonate twice a day, for example, to get enough elemental calcium of 1,200 milligrams of the calcium by itself. Forget the carbonate, the calcium by itself. Calcium lactate would have less. So there are different formulations. So when you look into the tablet or your vitamin, many people take multivitamins. You have to see how much calcium it provides you. So nowadays, we seldom ask people to take as much as 1,200 milligrams elemental calcium, the calcium itself in a day, in forms of pill. You get it from your food, and then you take a few hundred milligrams of calcium in the form of a pill, a tablet, yeah. So calcium carbonate, 1,500 milligrams is not full of calcium. Only 600 milligrams is calcium.
Yeah, correct. And that's actually one of the questions that sometimes patients call it up. And they say, doc, in the box there is written 1,500 milligrams of calcium. And is that too much for me? When you look carefully, the elemental calcium might be only 600. So you go by the 600 rather than 1,500 milligrams. Right?
Yeah, got it. Jason, is jogging recommended for older person? I'm 62 years old. Is it okay for us to jog? How often can we do it and the duration? It's from Celine Fernandez.
Okay, I think when this question, it really comes back to the one that Dato mentioned earlier. Dato put out a really good point. When jogging, generally it's all right to jog, but it really depends on the patient's previous mobility. whether the person is all this while active or really out of the sudden they feel like jogging. Okay, it would be recommended to go slow. You can consider a few types of things when you tend to consider jogging is how frequent you jog in a week. So it is recommended to do about 3 to 5 times a week for about a light 20 minutes to 30 minutes is recommended. But the intensity you have to consider, there are many factors that influence the intensity, such as the location which you choose to jog. Some people tell me they jog around tar roads, though. So tar roads actually gives a higher impact to the person's knee, to the person's joint. Now, if you compare it to a softer track, like those they have it in Bukit Jalil Stadium, they run around those softer tracks, those would be of a better option as well, if given they have no problem with their knees, no problem with their joints, as Dato mentioned. So certain people, you might need to consider their existing condition as well, whether they are pain-free while doing the exercise. Always consider exercise as good when it is done pain-free and without much difficulty. So it's best to get it checked if you have any discomfort before engaging into the exercises without monitoring. You can go ahead, but if you're not feeling right doing it, then you need to stop.
Okay, there's one question from Anis Kamal. Any supplement good for your bone? I think we have sort of like answered the question, right? Any supplement good for the bone? Yes, it's actually calcium and vitamin D.
There are so many brands out there. So have a chat with your pharmacist. And 800 to 1,000 international units of vitamin D a day for an older person who's not much out in the sunshine, and a few 100 milligrams of elemental calcium, or get the calcium mostly from diet would be better.
Yeah. One question from Yunlin Chin: can osteoporosis affect nerves or cause nerve damage or neuropathy? Maybe Dato wants to answer this.
Osteoporosis by itself, a porous bone, it doesn't really affect the nerve function or compression of the nerve. But if there's osteoporosis and fracture, compression fractures, particularly on the spine, the vertebra, the thoracic and thoracolumbar region, and the collapse can be quite bad, that is causing an acute angle around the spine level at the thoracic and lumbar spine there. So that can actually impinge on the spinal cord or the nerve and the nerve exit. So some patients, they do have that kind of nerve symptom after they get these fractures of the the spine with acute angle. Whereas some patients actually fall down and shattered the fracture, the wrist bone. And where you get displaced fracture of the distal radius or the wrist itself. With that kind of acute angulation, that can actually cause compression of the carpal tunnel, the median nerve here. So it's actually more as a secondary, the pressure effect because of the acute angle of the fracture site, and that can actually compress on the nerve itself. But that occasion we do see in a clinical practice.
Thank you. One question from Su Sui Ha: is cycling the suitable exercise for knee joints?
Maybe I can take that first if there's any information needed to be added. Now, cycling, it generally gives that mobility to that knee joint, and it's when it's training under cycling, it's more to an aerobic because it does not give so much impact to the knees. So is there anything you Dato would want to add on?
Okay. Cycling actually, yes, good exercise in a way that you do not really pounding on the joint as such. But and cycling also very good for improving your muscle function, the muscle bulk, muscle strength, particularly your thigh muscle, quads, hamstring, hip muscles, and also the leg muscle. So, but bear in mind, some elderly, our senior patient, they are 60, 70, they are a little bit unstable. So you have to do cycling. Let's say we talk about indoor cycle, and they want to climb onto the cycle. So that you be careful, all right? Because you don't want our parents actually fall off from the cycle itself. So, and in that case, actually I recommend pedal. Pedal be safer. And actually sit on the chair, put the pedal on the floor, and similarly, you can actually tighten up the pedal. You can actually adjust the seat, the distance from the pedal, so you can actually cycle with the pedal rather than on the cycling itself. Secondly, you talk about outdoor cycle. Yes, outdoor cycle definitely also very good for your muscle strength, muscle bulk, muscle function. And but let's say you are those really into cycling 200-300 kilometers every time you go, you're gonna abuse the knee. Be careful on that. You can actually cause a lot of loading on the knee joint. You might start having knee pain and knee arthritis.
One question from Fan Li Shang: is cervical spondylosis part of osteoporosis?
Cervical spondylosis actually refer to the degenerative changes of the cervical spine. Okay. Similarly, actually the same concept applies to the lumbar spine. So because of the accumulated damage over many years of poor posture, so on, you do get like a degeneration in which you get a dry degenerate disc, you might get a disc protrusion, you get spur or ossified actually form along the spine itself. Similarly, it happens in the lumbar spine. So all these are mainly degenerative changes over many years. And some patients who have primary osteoarthritis affecting fingers, knee, they also get that kind of spur at the cervical and lumbar spine. So it is not a direct issue with osteoporosis itself. It's a totally different condition.
One question to Dato from Mrs. Lam. As prevention, when do we need to go for bone density tests and how often?
Now, bone density tests, we talk about indication. And also there are different guidelines for different part of the world, different organizations. And generally, some organizations, the international group, might recommend a bone density only after 65 years old for a lady and 70 years old for men. But that kind of concept, that kind of indication might not hold true in many setups. So it all depends. Let's say you are 50s and above, and you have strong family of osteoporosis, and you yourself have risk factors. It's time for you to get a bone density done. All right, say the best would be that menopause period and with all these risk factors. In fact, many healthcare services that actually our medical center do mammogram, pap smear when you reach certain age, right? And many times they actually do not include the bone density. That can be used as a baseline, but mainly it's actually if there's indication indicating that you are at a higher risk of developing osteoporosis, then you should go for bone density. So it applies to individual risk profile and so on.
I think this question is to Dr. Tan from Lilian Lee. Is there any food that can affect our bone health?
In food that can worsen bone health. I'm not sure, perhaps, yeah, maybe Dato Lee would like to take that, but I'm not quite aware of food that can worsen bone health.
The common worries might be whether coffee, all right? And coffee, one glass, 1 cup a day, not an issue at all. If you're, people call you kopi or gao lady, if they call you that kind of name, where you wake up in the morning until at night, every time you drink is coffee or gao, that kind of thing, that might actually cause a big issue with the bone, your bone loss. Otherwise, moderate amount and just not an issue at all. Another one, people worry about those carbonated drink with high phosphorus level. That might also drain your what you call the calciums and causing increased bone loss. So that's why replace all the carbonated drink in the fridge with milk, all right, with all healthy food like yogurts and that kind of thing. And that will be better. So I think mainly worry about affecting bone will be high phosphorus carbonated drink and coffee, of course, alcohol.
And avoiding smoking, but that's not a food. Actually, I'd like to add.
And that's a food, Dan. That's some people call that food for them, though.
Tobacco, if chewing tobacco, maybe, I'm not sure. But could I add a little bit about pain? I think sometimes people have back pain, they have pain here and there in their joints, in their muscles. As a geriatrician, we deal a lot with older people with chronic pain. But the doctor and the nurses need to take a good history to try and differentiate the cause of the pain. Because the pain may be from, for example, muscle tightness, a muscular pain, or a pain from a fracture or swelling. Then there's also a type of pain called neuropathic pain or nerve pain, which is from nerve compression. For example, as Dr. Lee spoke just now, that perhaps a fracture then is pressing on a nerve exit route. So to give a painkiller, we need to try and determine the type of pain first. And painkillers are not the only treatment for pain. It'd be looking for the cause, whether there's anything that can be done specifically for that cause, and also prescribed exercises. Try and see a physiotherapist to get specialized prescribed exercises instead of randomly doing exercises. If you have a specific pain in a specific area, see a doctor and who might refer you to a physiotherapist. Yeah.
Miss Chu,
Yeah.
Miss Chu, you realize that even up to now, we still have 90 audience on a Zoom, you know. That's very, very encouraging for us actually.
Yes.
It's the first time we run it.
Yes.
And
Yes.
everybody's staying back to actually listen to Q&A, which I really respect and thanks everyone.
Yeah, and Dato', there are lots of questions that we have not actually answered yet. May I suggest something? For those who have actually posted the questions on Zoom, maybe perhaps they can post the questions onto our Facebook and we try to answer them. Yeah, but for now, we try to see what we can do with those questions.
Sure.
There's one question from Chi Kui Lian. Dr. Lee, I'm on tamoxifen and have osteopenia. May I know what supplements should I take?
Okay, I think important here is tamoxifen means a patient who has breast cancer and is undergoing treatment, all right, for breast cancer. So the medicine itself, the treatment for breast cancer itself, and the chemotherapy that patient might need to go through, the radiotherapy patient need to go through, all these are causing a negative impact on the bone health, right? So sometimes your osteopenia, if you're low osteopenia, your oncologist might actually suggest to actually put you on bone protecting agent. It can be a tablet form, it can be a 6-monthly injection form. And also important to see whether do you have skeletal mets, means that you have that bone metastatic lesion, so that your oncologist even be more aggressive. Even though your osteopenia, they might actually put you on all these bone protecting agent to reduce the bone loss secondary to treatment and also to the disease itself. Supplement wise, of course, the same as what we discussed earlier. Make sure that enough calcium, vitamin D, and protein, and all those must be adequately given as a baseline, whatever treatment that you go through. Okay, so that's why you might need high dose vitamin D if your vitamin D is adequate, because there's some studies show that vitamin D is very important in terms of breast cancer patient and in terms of the skeletal mets, and so you must make sure you have adequate vitamin D. So your oncologist might put you on very high dose vitamin D as well.
Another question from Celine Fernandez. I think Dr. Tan arrested your question just now. She said Dr. Tan would suggest that park management should consist of qualified people who can identify the dangers of that park poses for senior citizens and rectify those dangers. But local authorities will listen. I think maybe there is a point there. Basically, they need some advice from the specialists on how to manage parks for older people. Yeah. One question from Facebook. If one has a hip problem, is cycling an acceptable exercise?
Jason, you want to take that? You're muted, Jason.
Sorry. Yes, I think my line was a bit clear just now. What was the question posed again? Sorry.
Yeah, from Eleanor Lim Soon, she asked, if one has a hip problem, is cycling an acceptable exercise?
Frozen again, I think, Jason. Yes, Jason.
Yeah, he's frozen.
Yep. Okay. So sorry, really a bit blur. Perhaps if anyone else can answer that, that would be a bit good.
If you're talking about hip problem, depends on what you're talking about, huh? Is it a soft tissue issue or is it a joint? If you actually have been diagnosed having osteoarthritis of the hip joint, it all depends on the grade, all right? It's a mild, moderate, severe one. And you know that you have severe hip osteoarthritis, all the space, the joint space is narrow, bone surface is very rough. So cycling definitely is not good for you in that kind of circumstances. You have very mild osteoarthritis of the hip, where the joint space is well maintained, symptom control well. You want to do cycling, you need to adjust the seat a bit higher so that you do not actually bend too much at the knee and the hip. Secondly, you do not tighten the tightness of the cycling so that it reduce a little bit of loading axially on the hip joint. So it really depends on what condition you talk about. Osteoarthritis of the hip, severe one, cycling might not be good. Mild, yes, it's still acceptable. Adjust the height, the seat height, as well as the tension of your cycle.
Okay. From Jillian, kids 8 years old who doesn't like to drink milk, can we supplement with calcium tablets and how much?
Yes, Kimman?
Oh, I'm so sorry. I wouldn't like to comment. I'm a geriatrician. I look after older people in case I give the wrong measurements. So yeah, we better ask a general practitioner or a pediatrician for that. Yeah,
but
preferably from natural food would be better.
Correct.
Kids eat natural food. You know, the best nutrition is actually from natural food, not from the supplements and milk powders and all. They are only for people who cannot manage to eat enough good quality natural food. Yeah.
And I think there are other food which contains calcium as well, not just milk.
Yogurt, cheese, and all those dairy products.
Yeah.
All right. And there's no reason actually, in our populations that kids do not receive inadequate calcium vitamin D. In fact, we have a very, very, big problem of obese kids and things like that. So they eat too much, they're feeding them too much. Sometimes maybe the issue is not the kids, it's the parents, right?
Yeah, true. Irene asked, bone density test showed osteopenia and wrist area is weaker than hip and spine. Any methods to specifically improve wrist area other than taking calcium and vitamin D?
Okay.
From Mrs. Chan.
I would take that to answer Irene, okay? Now, just a joke, might want to strengthen your wrist, you might want to play more handphone and more your iPad, things like that. You're hitting your fingers in the wrist all the time. But it's just a joke, okay? Now, bone density, most of the center we do on the spine and the hip. And many centers do not do the wrist, okay? And the wrist, of course, bone density is also important, but make sure that the density actually done at the correct position of your forearm bone. Okay, and in clinical practice, we do see patients saying that coming back, they have 3 scans done. Spine, hip looks normal, but wrist, osteoporosis or even severe osteoporosis, some cause a technical issue that they actually cannot measure the proper level of the forearm. Okay, and by right, you're supposed to measure something called 1/3 radius or 33% radius, which is a higher level that we measure the heart bone called cortical bone. But in some centers, we realize that the scan actually done at the distal radius or ultra distal, it means towards the wrist. So that's why they give it a wrong result of the actual forearm bone density. So be careful when you see a 3 result, spine, hip are normal, and then the wrist actually osteoporosis, and then as a doctor, we need to look at the picture itself, whether they actually scan at the right place or not. All right, are they scanning the actual upper 1/3 radius, or they actually scan at the distal radius, which is the lower part here, which is actually the wrong result. So that's why we do not actually embark on anything just based on this statement, because many times we do see that the scan is done at the wrong spots. Okay.
Okay. One question from Sally Ng. My calcium tablet has got 600 mg elemental calcium, 500 IU vitamin D3, and 60 mcg vitamin K2. Is one tablet a day enough?
Yeah, traditionally, again, that's going back to the old studies where they recommend 2 of those a day because it gives 1,200 milligrams of elemental calcium, and then it'll give you the 1,000 international units of vitamin D if you multiply by that tablet by 2. But nowadays, we tend to ask people to take the 1,000 international units of vitamin D and lesser elemental calcium, get the rest from food. And food, green leafy vegetables and sardines could have calcium as well, apart from dairy products, but it's mostly dairy products. So maybe you'd like to change brand from that, that tablet that you're taking. That's an option. Or else you just take 1 tablet a day also can, and you get the rest of your requirements from food. But if you're very osteoporotic, at least get the 1,000 to 2,000. Some people prescribe 2,000 international units a day of vitamin D. It's actually quite difficult to overdose on vitamin D, but about 800 to 1,000 international units per day would be good to maintain your bone health. Yeah. And before treatment, usually the doctor would measure your vitamin D level at least once to see the baseline, whether it's adequate or low. And if it's low, you definitely need supplementation before embarking on the osteoporosis treatment, like the once-a-week tablet or the 6-monthly injection. So the vitamin D calcium level needs to be replenished first before you go taking those other medications, or else those other medications don't work. Then when you go on those other medications, the 6-monthly injection and the weekly tablets, or either or, must continue calcium or vitamin D, or else those other treatment don't work as well. Yeah.
You know, that was the last of our questions.
Oh, thank you. That was so many questions. Yeah.
Yeah.
Thank you for the interest.
You managed to really answer all the questions. Thank you so
Time
much.
flies.
Yeah. Just to end this first session, I really would like to thank our panel of speakers, Dr. Lee, Dr. Tan, and Mr. Jason Chan. Thank you so much for your time. And thank you to all the participants who really participated so much in this first ever talk organized by the Society. Thank you so much.
Thank you to Henry, our technical man there.
Yes, thanks, Henry.
Backend guy.
Yeah.
Well, we hope everyone had a really enjoyable session today. And please do join us at our next session. We will post our next session on the Facebook page, and just keep lookout for it. Before I end, I'd just like to say, please take care of your bones, and really is healthy bones for life.
Thank you very much.
Thank you, everyone.
Thanks, everyone.
Thank you.
Thank you. Happy weekend.
Everyone.
Yes, thank you.
Bye.